Mr. Moderator, Your Excellency, the Prime Minister of Ethiopia, Your Excellency, Heads of State here, President of Djibouti, and the former President of Zambia has just left us, Your Excellency, Ms. Vera Songwe, the ECA Executive Secretary, the Executive Director of UNAIDS, my friend, Mr. Michel Sidibe. All right, I'm going to do better than the Senegalese moderator. Mr. Aikobje, Imokwende, the founder and chairman of African Initiative for Governance, and Halima Dangote, standing in for her daddy, Minister from Egypt, the Commissioner for Social Affairs, EU, and the soccer star extraordinary, minus the dreadlocks, Mr. Didier Drogba, the former minister from Nigeria, distinguished guests, ladies and gentlemen, a very good morning to all of you. Let me at the outset extend my sincere appreciation to the conveners of this very important forum, aimed at advancing Africa's health-related development goals. Equal appreciation goes to the sponsors and to the strategic partners of this event. I am particularly delighted that this event is clearly aligned to the key aspirations of our Agenda 2063, the Africa we want. Distinguished guests, this forum is vital in our collective pursuit of improved universal health care. It is also critical for broadening the landscape for private and public sector collaboration to ensure access to delivery of quality healthcare services on the continent. There is no doubt that health in Africa remains one of the key areas where governments and the private sector should partner to make sustainable investments which will benefit all our people. We also agree that through mobilizing expertise, financial resources, and innovation in the health systems, we will be able to accelerate the necessary interventions to rid this continent of social ills such as malnutrition, which we talked about yesterday, abject poverty and disease. All these challenges continue to afflict mostly women and children. They also threaten to diminish the efficacy of the workforce, the productive labor of Africa, as well as undermine sustainable economic development gains in our various countries. It is thus important that we acknowledge that there is a need for broader scope for a thriving symbiotic relationship between governments and the private sector in all the African countries. We must therefore collectively commit to fostering this strategic partnership, and I so do on behalf of the Republic of Botswana today. Distinguished guests, in the case of my country, Botswana, I wish to inform you that we have made some strides in embracing private sector partnership through the adoption of pluralistic health service delivery. In this regard, my government has made a strategic and deliberate policy decision to promote private sector participation in the health sector in recognition of the pivotal role it plays in the economy. I am pleased that the private health sector has demonstrated the willingness and ability to be engaged as a strategic partner in the long term in the provision of healthcare services in Botswana. As a demonstration of my government's unwavering commitment towards this public-private sector partnership, we have established the Sectoral Health High-Level Consultative Council, commonly known by the acronym HLCC, co-chaired by the President, myself, and the President of the private sector. This creates a platform for collaboration with the private sector and guides engagement towards access to cost-efficient health quality services. We meet at least 4 times a year. Among the key achievements my country has made in the health sector as a result of the public-private sector collaboration are 1, provision of air ambulance services through engaging local companies for airlifting patients. 2, utilization of intensive care units at private hospitals by public hospitals. 3, public to private referrals for specialist services such as organ transplants, hematology, oncology, vitreoretinal, dialysis, cardiology services, and managed care. And 4, referral and district hospitals also continue to outsource soft services such as laundry, security, cleaning, catering, and clinical waste. In addition, my government is currently in the process of outsourcing services to reduce backlog in obstetrics and gynecology. It is also our desire to, in the near future, provide the following services through existing and new public and private sector avenues, if not entirely private sector-led initiatives. 1, general surgery, orthopedic surgery, as well as ear, nose, and throat specialists. 2, training of health personnel in different cadres by health personnel, local and international institutions. 3, research partnerships in critical areas of health. And 4, complementary health financing through health insurance schemes. Having outlined the above, I wish to invite the private sector to explore the opportunities available in Botswana, for we have just publicized our budget for the provision of improved healthcare services. And yes, we're open to business, and you're welcome. Some of the areas that could be explored for possible collaboration between the public and the private sector include pre-hospital services, inpatient care, outpatient care such as disbursement of ARVs, preventive care such as immunization, diagnostic services, mortuary services, rehabilitation and step-down care, research and development, and 3, pharmaceuticals and manufacturing, as well as human resource development. Although not exhaustive, I hope that the above mentioned gives you a broad picture of immense opportunities available for public-private sector collaboration in the health sector in Botswana. It is our belief that the outcomes of this forum and the findings of the report we're about to launch this morning would paint a picture through which public and private sector can mutually work together towards a sustainable health economy and truly inspire businesses to transform the health sector in Africa. There's a lot of work to be done. We are the people to lead in that regard, and we, the leadership of Africa, are ready for the challenge ahead. Let us, through this initiative, rededicate ourselves to seeking new sustainable ways of consolidating the gains made thus far in the health sector. I thank you immensely for your kind attention, and good morning.
Thank you very much, His Excellency, for laying out the opportunities for PPP in the healthcare sector in your country.